Welcome to the Medicare Copilot webinar brought to you by Healthcare GPS. During this session, you'll discover who Healthcare GPS is, get an overview of Medicare Copilot, our premier product, and hear directly from Medicare agents who have experienced success using our platform. Healthcare GPS brings together a compact, agile team whose collective expertise spans more than a century in healthcare, consumer engagement, and technology innovation. Our mission is to transform how benefits are distributed and healthcare is navigated. We leverage generative AI technology, intuitive user interfaces, and comprehensive content to address the key challenges faced by both agents and consumers, from selecting the right coverage and completing enrollment to providing year-round healthcare guidance and improving health literacy. Medicare Copilot stands as the industry's first complete solution designed specifically for Medicare agents. By merging cutting-edge AI technology with extensive Medicare knowledge, Medicare Copilot revolutionizes client service delivery and business growth. Acquire and convert prospects efficiently, provide data-driven best-fit plan recommendations, and maximize operational efficiency. Over the past year, we conducted extensive interviews with numerous agents to understand their existing workflows and consistently identified significant challenges and obstacles throughout their processes. Common frustrations include spending excessive time searching for information, lacking streamlined methods to pair clients with optimal plan options, and juggling multiple disconnected systems, challenges that resonate throughout the industry. Medicare agents typically rely on a fragmented toolkit that includes CRM platforms like Agency Block and HubSpot, plan comparison and enrollment systems such as Medicare Center and Sunfire, and various communication and marketing solutions ranging from Zoom Phone to personalized promotional tools. Medicare Copilot consolidates all these essential features, functions, and capabilities into a unified platform, creating a comprehensive, single-source solution that enables you to manage every aspect of prospect and client relationships from one centralized location. The result? Satisfied Medicare agents who experience streamlined operations and renewed enthusiasm for their work, or as one beta user described it, less hassle, more fun. Medicare Copilot revolutionizes prospect acquisition and conversion through its integrated CRM system, seamless quoting and enrollment processes, round-the-clock personalized communications, built-in consumer-facing website functionality, and streamlined data collection and management tools. Medicare Copilot enhances the client experience by delivering intelligent, data-driven plan recommendations through AI-powered matching algorithms, streamlined plan comparisons with detailed insights, ongoing guidance and updates, and customized decision-making support. Medicare Copilot optimizes operational efficiency through integrated compliance oversight, streamlined automated processes, secure data management, and enhanced productivity that saves valuable time. Last year, we engaged 50 beta users to evaluate Medicare Copilot's functionality.
Medicare Copilot is a brilliant administrative system that every Medicare agent should have. It's the single space where you can do everything for your prospect or client.
You have saved me time and screen space by having all the tools like CRM, quote, and compare, and the AI feature all in one spot.
Healthcare GPS has revolutionized the way I assist beneficiaries in selecting the right plans. The integrated AI is truly a game changer.
I find it so easy to toggle between 2024 and 2025 plans to see quick snapshots of changes and to easily be able to highlight specific benefits.
Let me now walk you through the platform to provide you with a high-level overview of its interface and functionality. This is Medicare Copilot, an AI-powered all-in-one CRM, quoting and enrollment platform built for Medicare agents. The dashboard provides a comprehensive view of your business operations, displaying your prospect and client roster, appointment schedule, outstanding tasks, activity summaries, and an AI chat assistant for immediate support. On the left-hand side is the Medicare Copilot Global Navigation. Let's walk through adding a new contact. Although not every field is mandatory to get started, completing additional information allows the AI to deliver more personalized and targeted recommendations for your client's specific needs. A standout convenience of Medicare Copilot is its integrated CRM functionality, which enables you to send and monitor your permission to contact, scope of appointment, and needs assessment forms from a single centralized location. Select Next to complete sections for coverage history, provider preferences, healthcare requirements, plan coverage preferences, and required medications. Navigate to Plan Selection from the top menu, where you'll find options to choose plan types alongside a summary of your client's needs and preferences. Use Plan Priorities to establish ranking preferences, then access Recommended Plans to view the AI-generated best fit matches. Medicare Copilot analyzes all available plans and delivers the top 3 recommendations within minutes. You can sort results by best from top carriers or top plans by score, with the option to view all plans for comprehensive coverage. The platform also enables side-by-side plan comparisons. Select Generate Plan Recommendations to access detailed plan advantages and recommendations. The Plan Highlights section includes supporting references to verify accuracy and reliability. Scroll down to Benefit Details where you can compare specific benefits. Now let's explore the Medicare Copilot AI chat feature, where you can ask any Medicare-related questions and receive responses backed by verifiable supporting references. Consider it your instant gateway to comprehensive Medicare resources, including the Medicare Handbook, Social Security regulations, CMS guidelines, Medicare.gov content, decades of Medicare expertise, and complete Medicare benefit summaries. Let's hear from beta user Carissa Plummery about her experience with Medicare Copilot.
So my name is Carissa. I'll just do a quick introduction while I pull up my screen. Been in the Medicare industry 12 years now. The first 5 as an agent like yourselves, and then the next 5 as a sales director for Humana in Colorado. And then the last couple years, I've been with Benefits Life, a local FMO in Colorado, as the vice president. Primary responsibility has been training agents and ensuring agent success with all the tools and platforms we have access to. We had the privilege of piloting this program with our agents, this AEP, and I can't tell you what a major difference it was in their business, being able to use a tool like this. People, agents that had big books of businesses versus agents that were just starting, help support them all throughout the way. So I'll kind of walk through some of the features that we found most helpful and show you why this is such a time-saving, amazing tool, like all in one place. So right now I'm just in a client, and you can see up here, we're going into his client profile and needs. What's great about this CRM is right from here, you're able to send the permission to contact if you met them at an event or you're at an event and they just need to fill that out real quickly. This is what that looks like, very simple. So just their name and information, and then you have that saved in your CRM for you to stay in contact with them. Also have the ability to send a scope of appointment, which is important to meet that 48-hour rule. You're able to, check the boxes, have them fill out this information for their name, sign it. And then this is in the back end, you're able to fill out the information when you met with them. And again, this is stored in their information whenever you get audited. Another really unique aspect of this is the needs assessment. So already you're able to send out in advance, get their prescription information, their doctor information, anything they want you to know as far as current plan, what they're looking for in a plan. And then that gets sent to you and loaded into your CRM, which ultimately helps you arrive at a plan decision and go over different plan options for you and the member. So we'll go into coverage history. You can see here, I put in their current plan information. This comes up later where we can show you how easy it is to compare the current plan with what other plans you're considering for the new year. Providers, this is another great tool. So similar, you're able to just put in their provider information. It will pull up the doctor that you're looking for. If this is the primary care, you'll just simply add the provider, select the correct location, and you can select more than one. go into their healthcare needs. So C-SNPs have become more popular, especially as we're looking at, D-SNP and SEP opportunities kind of changing this year. C-SNPs are one of those that you can roll year round. So this tool actually helps you identify if they qualify for any C-SNPs in their area. Coverage preferences, dental, vision, over-the-counter transportation options, you're able to select that. Again, way more detailed than all of the tools that we currently have access to in the market as far as what you're able to select to see these different plan options. And then their prescriptions, select their quantity, save that, and then that gets loaded there. And select their pharmacy. And then that will carry over to the plan selection. While you're in a presentation, though, sometimes you want to be able to double check on if they have a special enrollment period or what their current plan information is. So this is a great example of how the AI can help you during these appointments. Say someone's plan, can someone enroll in February if their plan ended in December? I would just type this into the chat. It develops a response. Oh, look, they do have a special enrollment period if their plan ended. And then it pulls the exact document and where it got that information. So then we're able to show the client, yes, you can enroll using this SEP during this time. And then another great portion is to the right. You can just toggle over and select their current plan. And when we do that, now we're able to ask the AI questions about their current plan. So for example, the member had a question on their dental. So instead of pulling up the summary of benefits, going to page 8 or whatever page you're trying to memorize to find that information, simply type in dental. The AI goes right to the page about dental, and we can easily see that the dental portion of this plan pulls up right here, and we're able to read what's covered under this plan. They have $1,000 coverage. It covers, bridges, etc. Okay, great. So now we carry that into the plan selection and comparing their current plan. And then it will score the available plans and help generate plan recommendations based on the information that it was given. And so you can see the recommended plan is here, and then 2 other good options here. Gives you a brief overview of these plans, if the providers are in network, the drugs that are covered, the plan documents, summary of benefits, and then it will generate the plan advantages and considerations based on what you had selected in previous screens. And then you can see as we go through, the providers are covered under these 3 plans, their drugs are listed as covered, their pharmacy is in there, all these extra icons to kind of explain what extra benefits are important to the member and what are covered with the plans. And then you're able to type to the AI a question to compare specific benefits, for example, dental. And it will pull up the 3 different dental benefits of each of the plans, which is so great. If you think about it from a time perspective, if you're selling in multiple states or you don't have all the 50 plans in your area memorized, that's okay. You don't have to. This tool, you don't have to do all this homework in the beginning. This tool is able to generate this information, and then you can have a nice comparison of each of the plans and pull up exactly what dental benefits are in each plan to make an educated decision. And up at the top, we will, you can also compare the current plan. So then it would just move the current plan to the left, and then the recommended, and then the good fit over here. So then you're able to compare those, or you can simply go to all plans. And let's say they have a preference on a specific carrier. You're able to sort by carrier, by type, by plan type, by DSNP, and compare those plans that way. Like happens in most appointments, someone says to you, hey, I actually got this letter from Medicaid. I don't know if this matters, but it says I have full Medicaid now. Okay, great. So this is a big pivot. Instead of you going over, non-SNP plans, you're able to just change this, and now you see all D-SNPs, and then you're able to compare the D-SNP plans, okay? So things that would normally take us a lot of time that we might have to do on the front end or get back to the client, this tool just allows you to do immediately. And then you're able to go to more details. And then with all the changes with prescriptions this year with the M3P and all of that, you're able to see what they would pay monthly for the drug.
Next, we'll hear from Annette Todd.
My name's Annette Todd. I'm in Southern California, and I have been working in Medicare sales and marketing and broker training since 1991. So if you do the math, that's 34 years. It seems like such a long time, and yet, it's been a wonderful career, and I'm really happy to have made the switch from training agents to being an agent. When I decided to leave the corporate world, I thought, well, I don't really want to just stop doing what I love and what I know so well. So it's been a great fit to move into being an independent agent. And as an independent agent, I love healthcare GPS and the MedicareCopilot because it allows me to own my own data. So when I enter my prospects and my own clients, I know that I've got them. And in fact, I'm one of those old-fashioned agents because I'm independent. I used Excel. And so, every time I made a change, I'd have to go to the plan, kind of look at their data, and then build an Excel spreadsheet. But with that, I was easily able to import my contacts. So they made it really easy to upload my own client list and my own prospect list to this. And it's been a joy. So if I want to isolate, I can kind of look at my list of clients and sort by birthday. I can sort by plan that they're on. But the real nice thing has been during AEP to be able to use all those nice features that Carissa showed you. So I was sitting with a client and his wife, and they were on a PPO last year because they thought they wanted to see these out-of-network providers. But as it turns out, throughout the year, they had the PPO, but they found they weren't seeing the providers they thought they would. They were seeing a provider and really liked a new PCP that just happens to be in network with a lot of HMOs. So they thought they really want to save money. And I understand that. They don't want to keep spending co-pays every time they go to the doctor or co-insurance. So we sat down, and just as I was talking to them, and this could also be completed with the needs assessment, the fact that he has diabetes, he showed me his insulin, and he also rolled up his sleeve and showed me his continuous glucose monitor, talked about how much they liked it, but also mentioned that they no longer drove, and they're way down in Oceanside. Their son lives up in Mission Viejo and could come down once a week, but they really needed some help with transportation. And also with that, they needed groceries because they could walk to CVS and carry home a little bag of prescriptions, but they really couldn't walk to a grocery store and carry home a week or, even a few days worth of groceries. So that just came up in the interview. So they currently had the PPO, and this is the doctor that they had found that they liked that was in the PPO, but he was in the HMOs as well. Even though he has a diabetes, he wasn't going to the doctor too much, and the PCP was taking care of his diabetes. He wasn't even seeing a specialist for that. So really, when it came to kind of defining their coverage preferences, it really was saving money. It's some of these people that are sitting on a really valuable house, but really don't have a lot of extra money to spend. So as we started looking at the plan selection, their priorities were total out-of-pocket cost as the must-have. And everybody gets the chance to do this, each broker or to decide what it is they're looking at. They didn't really care about a premium give back. I shouldn't say they wouldn't appreciate it if it were available, but they were really looking for their doctor and transportation. So as we keep moving on with this, we started with recommended plans. So their current plan is the PPO. One of the plans that came up as something to look at is a C-SNP, and the other one is just a very good standard HMO POS plan through Anthem. So these are all well-known plans here in Southern California. I love this tool. I used it every single day. I'm still using it every single day because nowhere else can I pull up all of my clients and all of my prospects. I've been using another system where I have to put in the name of a prospect in order to see what they've got. And it really is time consuming. I could never like pull up all the people that I've written, under a certain plan, except for that Excel spreadsheet, which is just rife with errors because I wasn't always the person to update it. But since all my data and even the enrollment is right here, it's a click of a button, switching them from a prospect to a client, and it's just amazing.
Thank you for your time, and we hope you found this presentation valuable. To learn more, reach out to us at sales@healthcaregps.ai or call 1-8886-002705.